Hi, and welcome to the Tribe's Vaccine Information Session. I am Tribal Council Member Chris Castleberry, and I've been honored to help lead the Tribe's vaccination effort. Snoqualmie Tribe is committed to making sure our community is cared for and that everyone receives the medicine it can and needs to survive during this pandemic. And part of that is making sure that people have the information and access to it to make these informed decisions for themselves. And some people have already taken this vaccine, but might want to know more about how it works or how this might change their lives after receiving the vaccine. Others might be on the fence about getting it and just want to know more about it. Again, I want to once again express my appreciation for tonight's three panelists who I've seen and I hope to continue to see throughout this whole process. I've been very familiar with this and I'm very excited to hear about all your expert knowledge and experience working with our vaccine clinic. Our three panelists are Dr. Terry Maresca, a lot of us know, Snoqualmie Tribe member and Physician's Assistant Barbara Holloway, and Eastside Fire and Rescue Battalion Chief Glenn Huffman. Again, all of you continue to have been part of this process and a very instrumental part of this process is taking place in a reservation. And again, my deepest thank yous. With that, let's turn it over to our first panelist, Dr. Terry Maresca. If you wouldn't mind getting us started with some information about the vaccine.
Yes, thank you, Chris. I believe Jamie's going to be regulating the slideshow right now, so I'll ask her to take that part over.
Sorry, technical difficulties. Give me just a moment.
Okay, all right, in the meantime, Sego, Seba Guego, Terry Maresca, Yunjats, Wakanyadan, Ganye Gehaga, Ibako Wanjodan. So hello in Mohawk. Good to see all of you relatives and happy to see so many people at last Saturday's vaccine clinic. It was awesome. I have been asked to kind of give a little review on a few items related to both the vaccine and a little bit about how things are going in Indian country, just to give some perspective on this issue. And we'll go ahead with the next slide, Jamie. So again, Nyawa to all of the people of the moon, all of you tribal members who are taking such good care of yourselves and the people who live in your valley. Your generosity, spirit continues, and I see that in the effort that you're coming through with the vaccination effort today. So Nyawa for that. Thank you. Next slide. Our objectives, since we're just working with the Moderna right now, I thought we'd focus just on that and how the vaccine works very briefly. A little bit about what's going on with American Indian and Alaska Native communities related to COVID, and a little bit about what's going on in Indian country in terms of just some of the efforts overall, so you can see how things are going with the tribe and be inspired by some of what's happening around the country. Next slide. So there are two vaccines that are available in the United States right now, both something called the Moderna and the Pfizer vaccine. And this is a new technology that's called messenger RNA, or alias mRNA. And the issue with this is that this has been studied for a long time. It's been going for close to 30 years. Some of it's been related to cancer associated issues, but other applications as well. And definitely its major test is this, related to COVID. And so the way these vaccines work is that it takes a small amount of this protein, which is a harmless part of the protein of what's called the spike. And we'll see that in just a second. The spike is just one of the features of the COVID-19 virus. And so this little set of protein is injected through the shot. It's also injected with a couple of other things especially fats. So it's kind of in a bubble of soap is how I think about it. It contains some sugars and something called buffers. And essentially this little piece gets into your cell. It doesn't go deep into the heart of your cell. That's called the nucleus. And that's where the precious DNA of what makes us human beings lives. It does not get there. So it gets into a cell, and that is what starts the process of our body making antibodies to fight the infection. And it takes, in the case of Moderna and Pfizer, it takes 2 shots in order to get full immunity. And it takes about 2 weeks after the Moderna to reach immunity of close to 95%, 94, 95%. Next slide. And this is a little schematic of that, and the little squiggly. I don't know if you could see this on my screen. I can see this, but there's this little squiggly piece. That's the mRNA. Once it gets in, it's these are the little spike proteins that it's reacting to, and it's starting to make antibodies. And those are these little green butterflies here, are the antibodies, which in the presence of this spike protein, it learns to recognize it and attack it. And this is what the COVID virus kind of looks like with these little blue spikes. And we see the little green butterflies kind of attaching to it, which is what neutralizes it. Next slide. This is another version of it. This is much more simplistic, and this is fine. So here it is. Here's the little squiggle, gets into the cell. Our body says, oh, okay, I have instructions to make just this little spike protein marker. And once it gets released into our system, our immune system goes, what? And starts to make incredible amounts of antibodies against it. Next slide. So just a brief review of what happened last year with the clinical, what's called the clinical trials, which is what led to the approval nationally for these two vaccines. There were a lot of people in these trials, 68,000 people. That's a lot for the two different vaccines. The important pieces, I think, were that there were just no higher rates of illness or death for people who took this shot. Again, the high effectiveness we talked about, 94 to 95% effective. And for things that really matter to us. So preventing serious illness and death is critical. It is, some of those people did get COVID. They had milder cases of COVID. The numbers of people who were American Indian in the trials is about 0.8%. And that's not inconsistent with what our population is, depending on whose census data you believe. So natives were at least reasonably represented in this trial, which was pretty good. Could have been better, but usually were not even mentioned. So I think that's really important. And the other important piece to me is since we know that this virus likes older people and also likes people with what we call pre-existing health conditions, these trials had almost 1 in 4 were 65 years old or older. That's very important because we don't often see that in trials. And almost 1 in 4 had some kind of a high-risk condition. And those high-risk conditions are like heart disease or lung disease like asthma or emphysema, diabetes, or being overweight, because those are risk factors for COVID. Next slide. This is another way of looking at it for those of you who just want to see what some of the ethnicity or racial profile is. And they're off to this side are the Pfizer and the Moderna vaccines in terms of how many people were represented in each of these groups. And again, is it the most ethnically diverse study ever done? No. Is it among the worst? No. It's kind of middle of the road, maybe slightly better, which is good. And again, it could have been better given some of the speed at which they were being asked to do this and to do this safely. These numbers look pretty good. Next slide. Common side effects of the vaccine. Many of you have already heard some of this, from perhaps friends or neighbors who've already taken this vaccine. Fatigue is common, headache is common, chills, plus or minus fever, and that fever can be very variable. Muscle aches, and just like you do have, quote, the flu. So achiness or joint pain is possible, and definitely a sore arm for a lot of people. And some liken this to like having had the tetanus shot in terms of just how sore their arm got, because most people and many people will have a sore arm after they get a tetanus booster. We do know that the side effects seem to be somewhat more common after shot number 2, but that's very variable. I've had many people with none, my husband included, who's over 75. And again, the side effects generally are not serious, and we'll talk about that in the next slide or two. A lot of people have been worried, rightfully, about are there really bad allergic reactions to this? And there was just a report that came out a few days ago from the Center for Disease Control that, again, is looking at what happens since the vaccine has been actually used in the United States. There's 61 million doses that have actually been given. And so they're looking at the safety profiles, which are looking really good. And yes, there were some adverse events, close to 7,000, which is basically 1/100 of 1%. So it's very small. And of those adverse events, 90% of those roughly were considered to be non-serious. So some of them were, but it's a very tiny amount. And I liken this to, people have more reactions that are serious to something like penicillin than they are to having reactions to the vaccine. Next slide. So another question we get a lot has to do with who should not take this shot, or is there anything that's a hard no? And the hard no here has to do with the preservatives that are in the vaccine. One of them is something called PEG, P-E-G, which is a big fancy chemical name called polyethylene glycol. And that's basically oil derived. It's derived from petroleum, and it's a laxative. So some of you who may be in the over 40 club may have experienced this, usually related to a prep for something called colonoscopy. So basically looking to make sure that there's no colon cancer. It's a colon cancer test. So anyone who's taken certain kinds of laxatives in preparation for something like this, that's how you might be exposed to that. There's another chemical that some people have life-threatening reactions to, something called polysorbate, and that's in quite a number of foods. It's in different kinds of makeup, it's in different medications, because it's something that helps to mix oil and water, which typically do not mix. And so if someone has a serious reaction to that, the answer is they should not take this vaccine. If a woman is pregnant or breastfeeding, she should really consult her healthcare team about the pros and cons of this. Although several major national organizations that are experts in the care of women with high-risk pregnancies and pregnant women in general have signed on to saying, yes, if you're in a very high-risk group, the answer is you may be taking that vaccine. It has not shown itself to have serious side effects, but that's being watched very carefully. People who have serious health conditions, such as active cancer treatment, or someone who's being treated actively for HIV/AIDS, someone who's on immune system medicine, and immune system medicines are fairly common in Indian country because a lot of our people have types of bad arthritis. I know my sister does. She's got rheumatoid arthritis. She's younger than me, and she's had to talk to her doc about the timing of the vaccine for her. But people might be taking immune system medicines because of asthma or because they've got psoriasis or other health conditions. And what this might mean is your doctor might recommend some change in your prescription medicines to allow the vaccine to work its best. There is a system to monitor these long-term side effects. And actually the study that I mentioned recently about, again, the serious allergic reactions after 61 million shots, part of that data is coming from this V-Safe system, which is a federal, it's a voluntary system that's been set up just related to the COVID shot. And for those of you who take it, you are given the opportunity to sign up for this if you want. And what will happen is that you will get some lovely text messages. I just got mine today because I've taken both shots already. So they're following up on me for the next 6 months. And that they would do the same for you. And so those of you who feel like you would want to contribute to the information that's going on in the United States, and that really we are helping to inform the world for better or worse because of just the very high numbers of COVID cases we have here and the size of our population, the information that we're learning from this is going to benefit people around the world related to the side effects that this vaccine may have long term. So I think this is an important thing, but it's completely optional. Okay, so another question that comes up a lot is, can we, I know as much as I love all of these adorable masks, I'm a little, and I would love to be the first one to give it up. The question comes up about safety practices after taking the shot, and the answer is no. We cannot stop doing this. And so most of you know all the basic rules in terms of just hand washing or physical distancing, the wearing of masks routinely, especially in enclosed spaces, the issue of restricting our travel. And there are definitely questions still about carrying the virus in our nasal cavity and potentially spreading that. And so the jury is out on this in terms of how much any of the vaccine alters this. And I think we'll find out more as time goes on, hopefully later this year. But of course, there's a lot more information coming out about different variants of COVID around the world, including California, which is a pretty close neighbor of ours, and there's a lot of traffic going north-south here. And this California variant is like some of you may have heard of variants from South Africa, from the United Kingdom. and other places, Brazil, are things that are being watched really carefully. So we have to really protect ourselves from spreading this throughout our communities. As far as American Indian, Alaska Native, rates, just again, I think I may have said this before, I don't want to belabor the point. We know that certain illnesses, certain health conditions are linked to worse outcomes, meaning you're in the hospital because you're so sick, or worse, so that you don't make it out of the hospital. And those conditions are listed there, including kidney disease, which is much more common in Indian country. And we know that more Native people have these conditions, but so do other people of color too. And so this is part of the health disparities that our people around the country are talking about, and how we could do a better job addressing this. The infection rate for Natives, though, just infection, not just whether not getting in the hospital or death from this, is much higher than our white relatives. Very high. So 3.5% of just, we have many times higher infection rate, to say nothing about what happens if we get an infection. And so just looking across the board nationally, the rate's almost 3 times the US population as a whole in terms of actual death in Indian country from COVID. That's pretty high. And we have more people who are young who are being infected, and some of that has to do with multi-generational families, has to do with a number of things. But we have higher percentages of young people who are getting COVID. Next slide. The death rates, which is a very sad thing to think about. Many of you have already seen this, in the news, reading the paper, watching TV, other sites. Some of the states in our region are higher than most, and including Alaska, which is 4 times that rate, Montana, even higher, and New Mexico, almost 5 times the death rate for all races. It's very difficult to hear that for those of you who may have relatives in this area. Some of our tribes are doing amazing jobs at rolling out this vaccine. Cherokee Nation has been a very bright spot in the state of Oklahoma, which has not done well, as has very high rates nationally of COVID and COVID complications. The priority for this tribe, they were very clear. They wanted to protect their first language speakers. So the Salagi speakers, they were the first ones to get the vaccine. Their elders were first. And what they did is that because most people were going to tribal clinics, again, this is a very big tribe with multiple sites available for healthcare, those personnel called these elders and the language speakers. So they didn't have to worry about going through the computer and worrying about getting appointments. They were reached out to, and those appointments were made for them, and they were prioritized in a much more organized way. And all of their first language speakers got vaccinated by mid last month. That's amazing. Next slide. Tribes in Washington State have been doing a pretty good job too. Coleville Tribe out east is double the rate overall for Washington. Lummi Nation has been in the news quite a bit. They had a pretty comprehensive response, and they're considered to be one of the model programs in the country. They've got a lot of good press for good reasons, and they were a tribe that stepped up to be involved in the vaccine trials. So in the early phases with AstraZeneca, which is a different vaccine. The Coleville Tribes has shown their generosity by vaccinating school teachers in Marysville, which is amazing. And we have other good examples. So next slide. Urban Natives have hit the radar too. The first, once Moderna vaccine came to Washington State, Seattle Indian Health Board was actually the first site to get it. And it was a terrible rainy day. I will never forget it, because that's me getting my shot. And it took me 2 hours to drive from Issaquah to Seattle because the traffic was so dismal. But I'm telling you, that was a lifeline as far as I was concerned. But the health board's gotten a lot of good press also because of their prioritization of people who are at very high risk, and household members and other people of color. So we know we can do it right. Next slide. We have other relatives, lastly, down in Navajo Nation, again, the biggest tribe in the country. I'm so proud of them. I have many physician friends and other healthcare provider friends who work, who are from those communities and live there. They had a rough, just an awful summer. It's been very, very hard, still hard there. but their vaccine goal is 2 weeks ahead of schedule. They have over 100,000 vaccines in their population. And this is a picture of the line just to get to one of the vaccine sites. They have a drive-through program there. Their community has very high levels of confidence in the shots, but they've also been doing some pretty aggressive measures to protect the people, including some of their curfews and weekend lockdowns, and shelter in place has been much more aggressive than other places around the country. They also were involved in some of the vaccine trials too. Okay. So I've listed some of these sites for more information for those who are interested specifically in the American Indian data that's being shared. I would refer you to the Urban Indian Health Institute site or the National Congress of American Indians. NCAI, which is the middle one, they put out weekly summaries looking at what's going on around the country, which I think is really important, and they're working with Indian Health Service on this. The Center for Disease Control, alias the CDC, is well known, I think, to most Americans by now, and they have information in multiple languages that span information for individuals to workplaces to scientists, etc. So lots of information. As we kind of close this section of our event tonight, just a couple of things to be aware of related to things that are news that I think are worth knowing about. The South African variant is definitely behaving a little bit differently in terms of being more aggressive, and there are already some vaccine trials that are starting to fight this particular variant in case we need it, because it's looking like we might, and it's better to be ready than not ready. There are vaccine trials for youth. A lot of people are asking about their kids, and the answer is those are already underway for 11 to 17-year-olds, and then I think they're almost they're getting pretty close to having the group from age 5 to 12 next, which will be rolling out later this spring and into the summer. And so we're wondering whether, we don't know whether the dose will be the same for children or not. It might be a lower dose, so that's going to be part of this trial. It's also important to protect our precious women who are pregnant, and that's happening now with the Pfizer vaccine. They're already in what's called a phase 2/3 trial. So many of us are looking very anxiously at this to see how that's going to roll out. There is a different type of vaccine, something made by the company Johnson & Johnson, which is a single dose. And a lot of people are attracted to that, because it's easier to do maybe than two. That's effective, not as effective as the two that we currently have, but I suspect that once that gets approved in the United States, we may be seeing that pop up in other areas. Also related to shots, the Pfizer shot is looking like it might end up being a single dose if people have had COVID already, because the response to that is so intense. So, but that's not been approved. That's not been approved yet, but that might be on the horizon. And then lastly, I know I get a lot of questions related to plant medicine or to supplements, and people are asking about either vitamin C or vitamin D or supplementing with zinc. Some of the trials that are coming out right now don't look so great in terms of actually stopping people from getting COVID. It does not look good for that, but it doesn't look like it's making COVID worse. So I think that that's kind of just something to be aware of. I'm so proud of the tribe for exercising its treaty rights to vaccinate who it deems at risk and who's important to members within the community and its responsibilities. So, and that's your treaty right there. Others on this panel can speak to the issues of, again, how I can't speak to how Snoqualmie looks at this. I can only speak to how my tribe looks at this. And our original teachings really talk about the collective responsibility, that is our job. Our job is looking after each other. Our job is looking for the 7th generation, for the unborn faces that haven't arrived yet. And our ancestors did it for us, and it's our responsibility to do it for them, is one way that I think about this, and why I took the vaccine, and why I've tried to encourage my family to do that, to be able to protect our heritage. And I'll turn it back to Jamie and Barbara Holloway.
Thank you, Dr. Maresca. That was really great. Thanks for putting that together. Very informative. I'm Barbara Holloway of the Snoqualmie Tribe, and I work for Kaiser Permanente in Port Orchard as a family practice PA. I've been there for about 12 years and have enjoyed learning about COVID during this time, and really had a great time talking to people Saturday at the vaccination clinic and answering questions that people had. It's really important that people think about how they think about the vaccine and ask the questions that need to be asked, because there are a lot of answers out there, just a question away. Most of the answers from the research that I've done on CDC and Up to Date, which is a medical resource website, really clarified a lot of stuff as far as the safety and efficacy of the vaccines that are out there. The news will talk a lot about side effects and serious reactions, but those have been very minimal and mostly almost isolated completely to people who have had previous allergic reactions to vaccines in the past. Probably mostly what Dr. Maresca said about the vehicle that the vaccines carried in. It seems to be pretty safe. I received my second injection through my work January 31st. I did have a few side effects that are common, the body aches and the sweats and chills. They came about 20 hours after getting the second vaccine. They lasted through that night and were gone in the morning. One item that I haven't seen in any of the literature was a funny taste in your mouth after the vaccine, but I did hear that from a lot of people on Saturday and after the fact. So I think using that VSafe website to report any kind of symptoms that you may think were related to the vaccine that you received is important for collecting data and getting more information out there. Another thing that I did want to hit on I know that there's a lot of young people that are really thinking they don't want to get the vaccine, and I would urge you to reconsider that. That it's important if you're going to be around your family and maybe getting back to tribal meetings and things like that, that it's important to make it a little safer for the elders. Young people are a lot less likely to get symptoms if they get the COVID virus, but that doesn't mean that you're completely safe. There has been some research that younger people that are getting the virus but not having symptoms are having some effects seen on CT scan of their lungs. So it's not completely safe just because you didn't get symptoms. There still can be lingering effects of the virus even if you never got symptoms. So it is important to think about it, really search your soul and consider taking the vaccine if you are of the age to get it. For Moderna, it's 18 and older. And if you do have any immune compromising conditions or taking any medications that compromise your immunity, just talk to your specialist or your doctor. See if your medications need to be adjusted, but it's not a contraindication. It's actually highly recommended because you are at higher risk if you do get the virus. I think that's about all I have. I'm happy to answer any questions. I think at the end we'll be doing, each of us will be answering some of the questions that were submitted earlier. But any questions that come in later, I'm happy to help with that too. And just want to say again, thanks for everyone that put this vaccination clinic together. It worked very well. It was very smooth. I've seen a lot of things go together through my time in the military. And that was one of the smoothest I've seen. So thank you, and thanks for having me.
Thank you, Barbara. Again, Battalion Chief Glenn Huffman of the Eastside Fire and Rescue. If you wouldn't mind just taking it home, and then we can get back to answer some of the questions that have come up in the chat and some that have been prepared.
Thank you, Councilmember Castleberry and Dr. Terry. Great presentation. I appreciated listening to it and learning a little bit about the information that you provided. And Barbara, I concur with you wholeheartedly about the younger people that have been, thinking about they didn't need it or didn't want it. I think you expressed it very well that they certainly need to go get it, and everybody in our community, if at all possible, needs to try to get this. So it's just something out there to stop this virus from spreading and getting everybody back to a healthy and normal lifestyle. So yeah, a little about me. I work for Eastside Fire and Rescue, which covers basically from Bellevue to the Snoqualmie Pass and from Carnation out to the Highway 18 area, all encompassing with the exception of Falls City and the city of Snoqualmie. So anyways, we back in early December realized that we were going to have the opportunity and needed to vaccinate our own firefighters. And so I came in off of the trucks, and I came into work days to spearhead the effort. And along the way, Councilmember Castleberry reached out to me and said, "Hey, is there a way for us to partner up and distribute vaccine to the tribal members?" And of course, Eastside Fire and Rescue is founded on partnerships across with many cities and jurisdictions. And of course, we've been a partner with the tribe on some little efforts in the past. And we were like, absolutely, what can we do? How can we make this go forward? And from there, Councilmember Castleberry and a couple other board members, along with the casino and the governance of the tribe, we just all came together, thought about what we needed to do. How could we help one another? How can we use each other's strengths to build something and put it out there? And boy, oh boy, as Barbara, you just stated, thank you. Not that I was there, but there was a lot of people that had a lot of effort put into Saturday's event. And 300 plus people receiving vaccines is just awesome. It tickles. It's really good. So I'm pretty happy about that. We're actually shooting for about 500 this coming Saturday, and so we're just building on that and rolling. And it just is. It's so awesome just to know that everybody came together for the right reasons at the right time, and without a lot of government bureaucracy, we're able to push this forward. And while, little clinics are popping up here and there, but not a lot in Eastern King County in our service area, and particularly not for the tribe. And we really felt like that's somewhere we needed to focus. And that's why Eastside Fire and Rescue is extremely proud to be a partner with the casino and the tribe to get this vaccine out there. Next slide, Jamie. Yeah. So a little bit about what our team does. So through the partnership, Eastside Fire and Rescue is able to provide the vaccinators. So we got specific training from King County, and it fit along with our normal training, but it's just something we didn't do on a regular basis. And so we spooled up, we got people trained. We have roughly a third of our workforce is trained and is currently signing up to do not only the tribal events, but we also have mobile vaccination units. And so what that means is 3 or 4 firefighters every morning pick up a van at headquarters, pick up the vaccine, and they drive out to pre-designated adult family homes and or senior living facilities and or homebound seniors, and we deliver the vaccine to them at their house. So we're taking it to them. And we just feel that that's the most important thing that we need to do is make sure if you want the vaccine or you're able to get it, but you can't get out or you're having trouble on the website, so we're going to bring it to you. And it's been extremely successful, a little slow, but it's spooling up. The vaccine availability is not 100% there or 100% reliable yet. A lot of factors play into that at the state, county, national level. So we are continuing to push forward alongside doing the stand-up event at the casino on Saturdays. So again, I'll close a little bit before the questions and just say that I appreciate Councilmember Castleberry reaching out to us and providing the opportunity to make that partnership. And I honestly, I think it's going super, super well. And thank you.
Thank you. Again, Battalion Chief Glenn Huffman, it's been an absolute honor and just a privilege to see you guys work and to see what we were able to accomplish. Again, this has been very fluid. We've had a lot of ideas, you've seen it, but we chose the best one. Whatever stuck, we took. So it's been an amazing journey to see, like you said, the bureaucracy, those challenges that exist in all form of government, to see those and the council act to that, want to know the challenges up front and to see how we can work around it or work with it. So it's been amazing. And again, this panel is just one of those other evolving things that's just unprecedented. I appreciate everyone's time and your words and the amount of effort everyone's taken into to help our people better understand this. So Jamie, would you want to read or post the questions? Oh, there you go. I love it. Jamie, thank you. Would you mind reading it just so we have a clear?
Sure. So question number one, so these were questions that people submitted when they registered for the event. Number one was, do I still have to wear a mask after getting the vaccine, and does life go back to normal? Who would like to answer that one?
I think it was me, Barbara. I'm not sure what the last assignment was, but I think it was me for the first couple. The answer is simply, I still have to wear a mask for now. It doesn't mean forever. Back to normal, not quite yet. I think they need a little more time to study how long the vaccine's going to work for. We still have a lot of people that need to be vaccinated before we can get back to the new normal. But until we have a good herd immunity, which is what it's being called, a majority of the people get immunized, then the mask and the social distancing and hand washing should still be followed. It will be a little more, I would say it will give more of a chance once a lot of people are vaccinated, or a majority of the people are vaccinated, to have gatherings of more people, but the mask will still have to be worn for now.
Thanks, Barbara. All right, question number two was, if I get the vaccine, can I still get COVID and infect others?
So I think that was me as well. And cut in if I read that wrong. There were several emails today. So yes, you can still contract the virus. The thought is that you would be less likely to contract it. And if you did, you would be unlikely to have symptoms. But you would be able to infect others if you were to contract it.
All right, number three is there any point to getting the vaccine if I've already had COVID?
And there is a point, it's actually highly recommended, even if you've had the virus, to go ahead and proceed with the vaccination, because it again is not understood how long the immunity would last with a COVID infection. They're thinking right around 3 months, but they don't really know. So it is still highly recommended per the CDC to get the COVID vaccination, even if you've had the COVID virus before, as long as you're not having any symptoms.
Thanks. I know that's been a really common question we've come across.
Yeah.
Number four, does the vaccine protect against the variants currently in circulation?
So I'll address that best I can. Is that the belief is that the vaccine does protect you. However, as the doctor stated in her presentation earlier, there just is not enough information yet. And so and they are doing more studies and they're evaluating it. But the idea is currently yes, but that's a best guess by the scientists until there's just as more time studying. Doc, would you concur with that? And Barbara?
Yes.
All right, number five was, does it seem like there will be a need for boosters beyond the second shot due to the variants that are popping up?
So these are great questions, and the doc had a great presentation because it covered most of these. So it's a little easier to answer. It will just expand a little, and that is there is not a belief yet that you need to have a booster for any of the variants. However, they are still studying it. They're doing very diligent work at the scientific level to study and find out what changes, how they can make it. But as of today, the word is, no, we don't think you need to. That is subject to change. All things with COVID, as we've seen since, early in 2020, is that things change so rapidly on us that it's hard to keep up. But I trust the scientists. I trust the work that everybody's doing to make sure that they come up with and share the information as they come up with it. And they're working very hard to do that.
Thanks, Glenn. All right, if COVID-19 is similar to the flu, does that mean that a vaccine will be needed to administer multiple times a year, every year?
So that's a good question. I had seen this question prior to this presentation tonight, and I did a little research on the CDC website this afternoon just to kind of get the CDC's take on this. And they're two totally different viruses. That they're not that similar in terms of what they are, but they do kind of they react the same to the body, although COVID-19 being more severe reactions. I didn't find anything that talked about having to have multiple vaccines throughout the year. But again, I know I'm sounding kind of just repetitive, but it's just the way the system is. There has not been enough time to get a thorough multi-year study on the reactions of COVID-19. We're very confident that the vaccines that have been developed are going to at least reduce the effect on the body and save lives. We're very comfortable with that. We're just not had enough study to know if and what that looks like, 2 or 3 years down the road.
All right, question number 7, if you've already tested positive for COVID-19 infection, what are the side effects and can you still get vaccinated after?
I'm not sure who was going to answer that one, but I'd like to. I had read on Up to Date, like I said before, the medical resource website, that it did say if you had tested positive for the COVID-19 infection in the past, you were less likely to have side effects to the vaccine, actually, and you should get vaccinated after, again, as long as you're not having any active symptoms of the virus, then you pass your isolation period.
All right, number 8 is how long does the vaccine, oh, yeah?
It's Glenn. Can I add a little bit to that? And I think that Barbara is absolutely correct. And in fact, they had been asking, to wait 90 days after post-infection. And we, after this weekend and having some questions, went back and did some research. And Barbara, exactly what you're saying. And now they're actually suggesting that as long as you're symptom-free, regardless of the time, that we can do it. I'll just add on to a little bit about it is, over Thanksgiving, I had COVID. I was really sick from it. It was not a pretty time, and that's one of the reasons I was so energetic about coming in and helping our organization and our community get vaccinated against it. So what I've been having to wait 90 days is what the CDC had initially said, and even through January they were saying wait. And so I have not yet received my vaccination, but I can tell you as soon as I can find a place to get one, I'm going to sign up and do it. And I wish I would have seen that information sooner and I would have received the vaccine earlier. Again, if you have COVID-19, the suggestion is that you have the antibodies in your body still to protect you. But at the end of the day, you can still get it. And so I would prefer, even having had COVID-19 infection and being pretty ill from it, that I'm going to get the vaccine, and I wish I could have got it sooner or recognized that I could have got it sooner. So Barbara, thank you for letting me add on to that.
Thanks, Glenn. So number 8 was how long does the vaccine last?
I think that one was mine. Another question that has a lot of, that is not completely known, but it looks like at least 6 months and maybe longer than that. And some of that is also being based on studies that are happening in England, where they've vaccinated close to half their, half their population has at least gotten one vaccine there. And they're tracking to see what their antibody response is, and they're tracking to see what happens if people actually, the few that actually have gotten COVID who've gotten vaccinated. So I think we're going to see more information on that as this year rolls out, in terms of how long this lasts for. But again, for people like Battalion Chief Huffman, who had the disease, if he gets a single shot, the odds are he's going to have extremely high antibody responses, is what we're seeing with people who've had the natural disease. But their antibodies actually are higher with people who've completed 2 of the 2-shot sequence vaccines, even higher than that. So I hope at least 6 months, maybe much longer, is what it looks like.
Thanks. Okay, number 9. So these are a couple that you guys didn't get to see ahead of time that came in today. One of them is, I have a shellfish allergy. Can I still receive the Moderna vaccine?
I'll take that one. Yes, you can. So again, the 2 critical pieces of there's no shellfish in there, there's no egg in there. So I know I get those questions a lot. It's the issue of this PEG chemical and polysorbate. Those are the ones that are the no-nos if you have a serious allergy to that.
All right. And the last one that we had submitted, what if I can't make my appointment in 28 days?
I can jump
Make
on
it
that.
as soon as you can.
Yeah. So there's been a lot of information, especially in the last few weeks, about that. And initial data showed 2 or 3, 4 or 5 days either side of 28. Now, I saw data just recently that you could go up to 45 days post the appointment. Okay, so we want you, and I'm sure the doctor and Barbara would say the same. I hope that we want you in that 28-day range, because that's the initial what they had said from the CDC and the pharmacies who developed the drug. Now they're saying your antibodies from the vaccine are going to last a little longer, and we could push you out without harm to you up to 45 days apparently. But we want you to get in the 28-day window, and plus or minus 4 or 5, we're going to be super fine and flexible. So you don't have to be, if you got it on the 20th, you don't need to get it on the 20th of March, but maybe try to get it within a week. And again, that's just because that's where the data showed from the beginning. Do not be alarmed at all if you're 2 or 3 weeks out post. The CDC would not come out and make a statement like that unless they could back it up. And so while we would like to keep everybody, because it's nice and organized, in a 28 to 30-day window, it's not always feasible, but it doesn't mean that you're more susceptible to the disease.
Yeah, I think nationally we saw this kind of unfold in front of us this last week with the snowstorms. There was a lot of clinics that didn't get their vaccines. They were just completely unable to transport those. They had to be shipped back to the distributor and then now released. So I think everyone's kind of taking a collective breath of air or sigh with that information coming through.
And I would add, if I could, just echoing what was just said, that they are saying that it may be okay to wait a little bit longer, but I would say if we could encourage people to stay on the track that was studied as much as possible. Obviously, there's going to be extenuating situations where people just can't do it, but for them, to follow what was studied would be the best recommendation.
So those are the questions we had submitted beforehand. We also have one in the Q&A session if there are others that folks have. I know it looks like a few of those questions have been asked throughout, but one of them is, an elder has been declared terminal and has stopped all cancer treatments and who is currently on hospice. Should the elder get the vaccine?
I would say that that would be their decision if they would like to do that or not. So it would have to be a choice that they would have to make.
I agree with that. I think it's a question of quality of life in that case, for them, and they should talk to their loved ones and talk to their hospice team if need be, because taking that vaccine does not stop you from staying in hospice benefits. So if that was a concern, that shouldn't be a concern.
One of the other questions, I'm reading these out loud because the Q&A doesn't record for the online session later. So another question was, if I am vaccinated, am I contagious with COVID-19 for the first 24 to 72 hours?
I'm not sure I understood that question.
Dr. Maresca, it looked like you had answered it in the chat window, so I didn't know if you want to share that answer.
I did. So the question, the way I interpreted that is that if I take the shot, am I immediately contagious? In other words, can I spread it to somebody? So it's not, let's put it this way. There's maybe two answers, not from the shot. So, so the shot doesn't, you can't, there's no live COVID in there. So you can't be infectious from the shot. That's one. However, one of the issues that we as healthcare people have been dealing with since the vaccine came into play is that we're working in a high risk circumstance. And so from the time I get shot number one, it still takes, by the time I get to shot two, I've got a little over 50% antibody production, which means I'm not full immunity yet. So during that 28-day period to shot number two, and then 2 weeks later, which is when I might hit the 90s, could I get COVID? The answer is, yeah, I could get it. But I'm getting it from either my work or from my community exposure, and I'm not getting it from the vaccine.
Awesome. All right. Another question was, if someone is suffering from kidney failure, should they consult their physician prior to getting the vaccine, or is it safe to do so?
Yes, they should consult their provider. Mm-hmm.
All right, and the last question I saw in the Q&A here was, will I receive any official documentation that will help me travel, more specific through air travel, flying?
Everyone who gets a shot gets an official card that's like a little CDC card that lists the type of vaccine, so Moderna or whatever vaccine you got, with the actual what's called a lot number, so the specific vial that it came from, so it's got a number attached to it. And you will, if you remember to bring the card in, that's great when you get your second shot, and then that can be documented on that card. Right now, that's as far as the official documentation is going. And what I know from airlines right now is that at least the US airlines are not requiring that. They're not requiring seeing that yet. I have heard some discussions with other international air carriers in terms of how other countries might approach this in terms of looking at what they call an immunity passport. So maybe that's something for the future once, but we're not there yet. So definitely keep your card. It's like what your parents did to you when you were little with your vaccine record. You probably should keep this one somewhere handy. And here's the other thing too. People are very proud of this, which they should be, and are taking pictures of themselves with their cards. That's great. My vote with that is like, it's like a credit card. Don't show your number in terms of just identity issues. If you're going to do that, I don't know, put a Band-Aid, put something over that. Don't show your actual number, that you got for that card. So, but that's what you will get. So if that's helpful in the future, I guess that remains to be seen, because it's a political business decision, I think.
All right.
Thank you for saying that, Dr. Maresca. That's something that I think that we're kind of finding out the consequences of our initial actions after the fact, and now we're well after, oftentimes 4 weeks, and we're starting to see like that ripple effect of what people have been doing. So, and again, it's unfortunate that we're really able to take and learn from other mistakes or shortcomings, and I think that's why we've seen the success so far. and hopefully we can continue more success and hear from more of experts like yourselves. Jamie, is there anything else you had before we?
No, that was all the questions we got. We'll be posting this recording probably sometime tomorrow on the tribe's YouTube page. I really appreciate all of you for evening time, especially just volunteering to share this information and this knowledge, and hopefully it will help everyone feel a lot better as they're making a decision on whether or not to get vaccinated. So I just want to personally thank you for all of your time tonight in helping us as a tribe.
Thank you for having me.
My pleasure.
Yeah.
Thank you.
Thank you.